What triggered this is, and I triggered it actually several weeks ago, seeing a patient. That's usually what triggers most of my topics for podcast episodes. Is something happens within the consultation or the delivery or with a patient that emphasizes some aspect of treatment that needs to be developed and taught to any prospective doctors who use the device and protocol for their patients. So what happened was I had seen a patient, typical middle-aged woman, who had 20, 30 years of pain, headache, earache, jaw pain, and etc. Delivered the device, and she came back in 3 weeks. And as we know, the average number of, not the average patient, but the average number that the patient at 3 weeks says what percentage of their symptoms are diminished or gone, whatever those symptoms were of the list. The average is 70%, can be more, can be less. This patient came back and said, I don't know. I don't remember exactly. It was, I don't remember. I don't have much change. I haven't much change. She might have said 10% of her symptoms were changed. Well, that's very unusual. It happens, but it's very unusual. Now, after treating more than 3,000 patients and doing more than 5,000 consultations on this problem, I know what to look for and what to listen for. And so as I'm talking to this woman, middle-aged woman, and I didn't say anything when she said, I haven't noticed much change at that time, but I'm watching her and I'm thinking, well, what's my next move? And I'll tell you in a moment what I'll usually do. It goes one of two ways. But as I'm watching her, she's going with the device in her mouth. She had the device in her mouth. She promised me that she was wearing it faithfully 24/7. Thank you very much. I appreciate that, I said. And I'm watching her, and as she's speaking, and as I'm listening to her tell me that only 10% of her symptoms are diminished or gone, she's doing that. She's protruding her mandible.